Hello and thank you for tuning in. This is another of my presentations on vitamin B12 in pregnancy and childhood. In my previous presentations, I pointed out, based on the published studies, that vegetarian pregnant women have a very low serum vitamin B12 and very low concentration of this vitamin in their milk. I also quoted from one of the manuscripts a passage that stated that infants that are breastfed with milk that is low in vitamin B12 may develop different symptoms of a deficiency that include neurological problems. In this presentation, I will actually introduce you to a few cases of vitamin B12 deficiency that actually, again, are published in the scientific literature. We will begin with this publication. This is Morbidity and Mortality Weekly Report. This is one that is issued by the Centers for Disease Control and Prevention. Neurologic impairment in children associated with maternal dietary deficiency of cobalamin. Just as a reminder, cobalamin is the proper name of vitamin B12. This first case is one of a 15-month-old girl. This particular girl was breastfed for 8 months, and since that time was a vegan. So at 15 months, we can say that about half of her life she was on a vegan diet. And prior to that, she was breastfed. Now, before I go any further, I am sure this was very well intended. After all, breastfeeding is recommended by, if not all, the vast majority of professional organizations and physicians. However, exclusive breastfeeding, although the manuscript did not say whether this girl was breastfed exclusively for these months, but I think somewhat in between line, it is understood that this was the case. Exclusive breastfeeding is not recommended past the 6 months of age. So up to 6 months, children should be exclusively breastfed, but after that time they should receive complementary foods. At 15 months of age, she was diagnosed with lethargy, failure to thrive, developmental delays, and severe microcytic or microcytic anemia. The mother of this particular child was a vegan for about 7 months, and interestingly, apparently, she was taking nutritional and vitamin supplements. It wasn't stated in the manuscript whether this included a supplement of vitamin B12. The important finding of this manuscript that I would like to point out is that vitamin B12 deficiency this early in childhood may cause long-term problems. And I say this because what we find in the description of this particular case is that still at 28 months of her age, which is more than a year, 13 months after she was diagnosed with vitamin B12 deficiency, at which time she received an injection of vitamin B12 and then was treated with supplements. She was still delayed in terms of fine and gross motor skills. Fine motor skills deal with a small mass of coordination. For example, fingers holding a spoon or eye coordination. Gross motor skills deal with larger muscles such as legs and arms and rolling over and things of that nature. And then expressive language and receptive language. Expressive language is basically being able to verbally express ideas and stuff. Of course, at 28 months, children don't express a lot, but they are able to speak. The fact that this child had an expressive language at a level of 12-month-old indicates that she likely didn't speak at all at that point of time. And then receptive language, that means understanding what others are communicating to her. And then further at 32nd month of age, although some developmental progress was found, but she was still delayed in terms of development. And this was especially the case in the speech and language. The second case is one of a 30-month-old boy. This particular boy had uneventful pregnancy and was born at term and was exclusively breastfed for 9 months. Again, this was very likely very well intended, however inappropriate, okay, if this was done for that length of time. And then at 30 months of age, he was diagnosed with failure to thrive and mild global developmental delays. Global developmental delays, that means that he had delays in all muscle development and coordination. And then also severe microcytic or microcytic anemia. Microcytic anemia means that the red blood cells were larger in size than they should be, than normal. This mother was vegetarian for about 20 years, and only occasionally she had small amount of meat, fish, and dairy products. Apparently she was, on occasion at least, taking a B-complex supplement. Perhaps not often enough, since this wasn't helping in terms of prevention of vitamin B12 deficiency. By the way, I'm focusing only on the patients, but the mothers were deficient to begin with, and so likely vitamin B12 deficiency started as these children were already breastfed. 6 months after the treatment, which again was one with vitamin B12, because vitamin B12 was the vitamin B12 deficiency was the diagnosis. And we still find some delays in terms of speech development and fine motor skill development. However, the gross motor skills, so the coordination of large muscles, was already appropriate for the size of this particular, for the age of this particular baby. Now, I further included this table here with biochemical data on both of these patients. We can see in the second column, patient 1 is that 15 months old female, and then patient 2, 30 months old male. And I want to point out that there are actually several biomarkers here of vitamin B12 deficiency. Urinary methylmalonic acid, when it is elevated, it indicates vitamin B12 deficiency. The same is for homocysteine. The same is for, of course, serum vitamin B12. In both of these cases, it is really low, especially for the female, 100 picomoles per milliliters. That's extremely low level. Furthermore, we find mean corpuscular volume. That's an assessment of the size of red blood cells. And again, we find this to be extremely elevated, especially for the girl. Further, we find elevated hematocrit, which likely indicates also iron deficiency. Now, further, when we look at anthropometric data, I would like to point out at least some of this data. When we look at first length for age, I want to point out that when it comes to the data for the female, she was quite severely stunted here. She was 2.5 centimeters, that's about an inch below the 3rd percentile, so one of the lowest percentile, which indicates that only 3% of children would be at that level, which is extremely low. Length for age indicates a long-term malnutrition, and so likely, at least in case of this girl, she had vitamin B12 deficiency for a very long period of time here, for months for sure. The boy was actually a bit better off. He was at 54th percentile, which indicates this is data for 9 months, when he was 9 months. So at 9 months, he was okay. He did not have likely yet, at least not severe vitamin B12 deficiency, okay? Now, when we look at weight for age, again, we have very underweight. When we look at these values, 6.34 kilograms for female, for the girl, that's a weight of a 4-month-old child. And then when we look at the 9-month-old boy, even lower. And so also we find that the deficiency caused likely delays in terms of weight gain here. Similarly, unfortunately, we find a low value for head circumference, which, if not treated, could potentially cause irreversible damage in terms of neurological development of these children. I have one more case that I would like to discuss, and this is a 10-month-old exclusively breastfed boy. Okay, again, this boy was born after a normal pregnancy and delivery, but at 10 months, the diagnosis was of severe neurological failure, coma, and extreme muscular weakness, and then respiratory failure. And so that muscular weakness manifested itself also in the lungs not being able to really breathe in and breathe out. He was not able to sit on its own. That's something that should be done about 4 months postpartum or post-term after delivery. In fact, he was never able to do so. So not only that he wasn't able to do it at 10 months, but much earlier, which again indicates a B12 deficiency for a prolonged period of time here. And then head circumference, height and weight below the 5th percentile, which again shows inadequate growth. The mother was a strict vegan for 10 years or so. And so likely this inadequate intake, or very small, if any, intake of vitamin B12 was simply not enough to provide the nourishment for this particular child. Here are the biochemical data, and I would like to point out those that deal with homocysteine, with rather vitamin B12 here. And I'm hoping everyone will see how severe this deficiency was. When it comes to vitamin B12, serum vitamin B12, only 30. That's extremely severe. I have never seen before such a severe vitamin B12 deficiency in terms of this particular marker or indicator. When it comes to urinary methylmalonic acid, also severely elevated. When it comes to platelet count and white blood cell and mean cell volume, all of these indicate, in fact, this one also, red blood cell count, all of these indicate vitamin B12 deficiency. And then further, likely, we are also dealing with iron deficiency with this particular child, which is indicative by these low values of hematocrit as well as hemoglobin. Here is a quote from this particular manuscript. The hematologic response to therapy was prompt and confirmed the diagnostic hypothesis of nutritional vitamin B12 deficiency. As reported in the literature, the replacement and the hematologic improvement were not automatically followed by quick and complete recovery of the neurologic symptoms. Now I need to translate this, okay? The hematologic response to therapy was prompt, okay? So very rapidly these biochemical markers that we pointed out, maybe I go back for a second, these biochemical, these extremely low biochemical values got elevated, okay? So things improved when it comes to blood biomarkers, okay? However, it says here that this did not followed by the same recovery from neurological symptoms. So the neurological symptoms were long-term here, not a short-term, but long-term problems. And further, we find here, despite increased muscular strength, allowing efficacious spontaneous ventilation, that means the child finally was able to breathe easier, smiling, he wasn't able to do so before, and some interaction with the mother and the surroundings at the hospital discharge, the neurologic status was still severely impaired. And so we have to keep this in mind, that this is a very important issue. Vitamin B12 deficiency this early in life could potentially have long-term consequences in terms of neurological development of children. Based on what we learned so far from this particular presentation and those previous ones, I made several conclusions. Number one, vitamin B12 deficiency among pregnant vegetarian women is common. It is common. In the first presentation that I recorded in this series, I pointed out at least 1/3 of the vegetarian women were diagnosed with vitamin B12 deficiency, but this 1/3 was based on extremely low criteria for deficiency. And if this criteria was elevated, was higher, almost all of them would have been diagnosed with deficiency of this vitamin. Number two, low serum vitamin B12 concentration means low milk vitamin B12 level, okay? Which is not surprising, something we would expect. And then number three, low breast milk vitamin B12 concentration may result in hematological, developmental, and neurological complications in infants, okay? And then lastly, vitamin B12 deficiency in infants may have a long-term consequences. I'm not saying here that all vegetarian women will be deficient and all infants that are breastfed and will adopt a vegetarian diet will develop this problem. But I'm saying we have to be vigilant and monitor this level and take precautions, take vitamin B12 supplements. In one of my previous presentations, I recommended 500 micrograms of supplemental vitamin B12 or vitamin B12 in a supplement during pregnancy and preferably prior to pregnancy, so we can avoid these and other symptoms of the deficiency of this important vitamin. For more life-saving information, I am referring you to my newest book, Vegan, Vegetarian Mother and Her Baby, where you can find information not only about this vitamin, but also other important nutrients. You can contact me at ramucha@hotmail.com to find out how you can get a copy.